Last year, I came back from teaching at Beauty Boss, come home to my wife of 40 years, and she said, "How'd it go?" I said, "Well, went pretty well. They gave me this great little Beauty Boss memento." And I showed it to her. She said, "I've got two things to say. One, you are no beauty. And number two, you are definitely not the boss." So with that in mind, though, I want to shift the tone and really talk about something serious. We are in a period in time in our country right now that is very divisive. But I know that we can all get behind some universal beliefs and ideas. For example, how many of you right here would love to create the best, most optimal treatment outcomes for your patients? Raise your hand if you believe in that. Awesome. How many of you would like to have a nice, easy, steady, additional source of revenue into your practice? Raise your hand. I love it. We're united. How many of you right now are incorporating personalized nutrition, talking to patients about nutrition, maybe doing some lab testing, helping them evaluate their diet, helping them fine-tune their supplement regimen? Raise your hand. Okay? And the rest of you are just kind of fixing to do it, right? We're in Texas. You're kind of fixing to do it. So what I want to talk about today is how we incorporate personalized nutrition into practice. And what I've seen in my many years is this coming together of integrative and functional medicine with aesthetics, and the enormous opportunities that aesthetic practitioners can have if they move on over into the area of personalized nutrition. Now, this is a definition that I changed from the American Nutrition Association, and it's personalized nutrition is a field that leverages human individuality to build skin health and beauty from the inside out. That's what we're talking about. How do we build skin health and beauty from the inside out? We spend a lot of time and energy smearing stuff on our face and body. And the skin is a wonderful organ designed to keep stuff out. And yet, right now, as you sit here, 6-7% of your blood flow is going to your skin 24/7. So the nutrients, the quality of nutrition and nutrients that are in your bloodstream, that's what's going to your skin. So there are 5 reasons to get involved in a beauty from within kind of program in your practice. The first is to respond to patient interest. I have to tell you right now, if you start asking your patients if they have interest in learning about this, knowing about this, you will get a resounding yes. In fact, as we move younger and younger, the younger generations, this is their language. This is the language they are speaking. You will get better clinical outcomes. There's a disease I learned about in medical school called PPP. It's a little off color, but it was called piss-poor protoplasm. And that is, it really explains why you do the same exact procedure on 2 patients. One of them heals up beautifully, they turn out great, and the other one, delayed wound healing, swelling, erythema. It's because they have PPP. Piss-poor protoplasm. And if you don't address that, you do not get the best outcomes. You will distinguish your practice. You know, my aesthetic professional talked to me about my diet and ways that I could really improve and get the best results from my treatment. You can add a revenue stream, and it is my hope that some of you in this room become personally passionate about this. Today, Gen X, Gen Z, they want more than lips. In fact, surveys show that this is the age group that is most concerned about health and wellness and building health and wellness from the inside out. Now, I've got 5 simple messages for you if you're an aesthetic professional. Obviously, folks like Dr. Tacita, they're solid behind functional medicine. But for those of you who are aesthetic folks, 1, you are in the position to provide personalized nutrition and guidance. there's no cure for a crappy diet. If you come to see me, I cannot out-supplement your crappy diet. Just want you to know that. No, no number of supplements will overcome that. You don't need to become an expert to provide some basic guidelines. Patients are hungry for guidance. If you want to see people with deer in the headlights go into a vitamin store and watch, and they look around like this. It's overwhelming. They want guidance. And then I believe you can offer a small, curated group of products, 5, 7 products, that you make available that are professional-grade supplements. You know they're high quality. The patients can get them from you. You can also have an online store available. So where do you want to be with this? What are some simple goals? The first is obviously to foster some introspection with some open-ended questions. You can help connect lifestyle, nutrition to beauty, just in your dialogue with patients. You can build upon the patient's beauty motivations. And then I'm going to show you ways that I insert personalized nutrition into the normal, everyday patient journey, a patient experience in aesthetics. Very simple. You can also have an organized program. Now, there are many aesthetic practitioners now that are actually having a personalized nutrition program built right into their practice. And if you do that, you're going to begin to ask these kind of questions. Would you be interested in exploring whether your diet may be affecting your skin? Changes in your diet might help your skin. Would you like to get some help making sure that your diet helps to complement the great treatment we're doing here? And then finally, are you interested in getting maybe some lab tests? Now, you do this if you have a program. And if you do, if they say no, nah, I'm not really interested in that, fine. We're here for you if you are ever interested in this guidance, right? No harm done. If not, if they say yes, hey, let's start the process. But I don't know that all of you will have programs, but what you can do starting Monday is you can incorporate personalized nutrition into the normal patient journey. How do you do that? You do that through conversations. I'm going to talk to you about 5 conversations that are easy to do, and any of you can do it. The first is the nourish hair, skin, and nails conversation. So again, there's no substitute for a crappy diet. There are barriers to all of us getting healthy nutrition, right? We all know them. There are the low nutritional content in foods. The soils have been over-farmed. The exposure to toxins, the SAD, standard American diet, inflammation, leaky gut. These are all the issues that people deal with. And this always blows me away, is that this is the estimated average requirement. This is the amount of a given nutrient to meet 50% of the needs of a specific population, adjusted by age and sex, 50-year-old women, to meet half of their needs. And look at how deficient Americans are. Vitamin D, 94%, vitamin E, 89%, magnesium, zinc, choline. Are you still throwing out the yellow in the eggs? Where all the choline is that you need for the membranes of the cells of your bodies and to make your brain work well? Stop throwing out the yellows, please. Thank you. So you will have this supplement conversation with people. And you'll ask things like, are you taking a multivitamin, multimineral? Anything specifically for skin, hair, and nails? Is it professional grade? You want to caution them against overdoing fat-soluble vitamins and check for both DNDs and DNIs. Now, drug nutrient depletions occur when people take medicines, drugs, that deplete certain key nutrients. 26 million Americans take statins. What do statins notoriously deplete? CoQ10. Why is CoQ10 important? It is critical for mitochondrial health. Why is mitochondrial health important? For energy for the cells. How do we age? The skin ages, everything else, by losing mitochondrial function and actually losing mitochondria. So one of the fast check, are they on an antidepressant? All of these can be checked. And then there's drug-nutrient interactions. Obviously, you want to take people off the vitamin E and fish oils, just the way you take them off aspirin or NSAIDs prior to an invasive procedure. But the words I'd like you to hold on to, and this is actually at the core of personalized nutrition, and this has to do with vitamins and minerals, supplements in general, are conditionally essential nutrients. Conditionally essential nutrients. I had this ridiculous interaction at AAD with some guy who said, well, we get all the nutrients we need in the food that we eat. Really? Really? You mean to tell me that there aren't comorbidities and aging and unique needs that women have at times in their life, and there aren't people who have SNPs, genetic variants, that require significantly more nutrients, or they're taking medications? Really? It's hard for me to believe in this day and age that I'm having that conversation, but it's true. So it's your job to guide your people in this understanding. And I really believe in the concept of intelligent supplementation. If people are taking supplements, they need to know why they're taking them. Now, the next conversation, you saw Dr. Carniol had a very nice little graph on the bottom of, what happens after a procedure over time, and that is the build collagen from within story. What is collagen? Why do we need it? Well, it's 75% of the dry weight in the body. It's long fibers of protein, and it takes a lot of stuff, good stuff, to make collagen. You need the right amino acids, you need vitamin C, you need copper, you need zinc, you need vitamin A, you need silica. You need all of these ingredients to build collagen from within. Now, today, the discussions that you have are not, doctor, should I take a collagen supplement? It's really like, which collagen supplement should I take? Because it's ubiquitous. Now, I have to say, I was, at the very beginning, very skeptical of collagen, but there's enough studies out now, enough decent studies to show that oral collagen and topical collagen will have effect. Now, does it go where you want it to go? In my mid-70s, I'd like to eat collagen and tell it to go right here. Get your little amino acids and pop that baby up, okay? But it doesn't do that. It goes wherever it's going to go. Pero, the beautiful thing, I think, is that when you are doing a procedure like the Energet, what are you doing? You are bringing heat into the dermis. You are energizing it. You are beginning the process of collagen remodeling. But in order to remodel collagen, you've got to have iron, you've got to have vitamin C, you've got to have the right amino acids, you need all the right other additional minerals, and if you don't have that, you're not going to remodel your collagen well, which means you are not going to get the best result from your treatment. So the story is we disrupt the collagens either with needles, heat, or cold. The collagen unwinds. It becomes a scaffold on which new collagen is created. This is remodeling. And then when we do a procedure, we're essentially telling the collagen where to go, where to remodel. Okay, the next conversation. So far, easy enough? Easy conversations? Can you see yourself doing that? Say yes. Shake your heads. Yes. Thank you. Thank you. Next one is to fortify the skin barrier conversation. And the way I like to do this one is I talk about bricks and mortar. We talk about how the skin loses its ability to hold moisture in, how we're getting a diminished barrier with age. The skin has to stay strong. It's got to stay protective. And to do that, it needs mortar between the skin cells. That mortar is mainly driven by essential fatty acids that also participate in ceramides, essential fatty acids, vitamin E, are the key ingredients for this. These are all fat soluble. This is where good fat is healthy. There's a school of longevity where people eat no fat. And I know the physician who pushes that. I won't say his name. And he may live forever, but he is wizened and his skin is yellow and he looks to be 125 years old. You need these healthy fats for the barrier protection in your face. Now, here's the issue with the omegas. Up until World War II, the ratio of omega-6 to omega-3s was about 4 to 1. We need both fats, omega-6s and omega-3s. After World War II, with the advent of all the manufacturing, the synthetic, and the chemicals that we would put together, and the corn oil, the ratio of the average American that you might see has gone to 12 to 1. I've seen patients with 20 to 1. And we're just not getting enough of the essential fatty acids, the omega-3s, and we're getting way too much of the omega-6s. Now, what's the problem with the omega-6s? They push things down a pathway to create prostaglandins, which are inflammatory. So when we talk about an inflammatory diet, what we're talking about is certainly glycation, but we're from sugar, but we're also talking about too much omega-6s. Okay? So this is a pretty easy one for you. Now, this is a little bit more nuanced conversation. It's the gut-skin conversation. You might begin, again, we could spend an hour or two on this one. You might ask them, how much do you know about the gut? A lot of people now know about the microbiome. You know, there's certain things that are trendy. GLP-1, cholesterol, collagen, hyaluronic acid, the microbiome. It's in the vernacular. And so you can go into a short discussion about how gut health relates to skin health. And you can bring up any GI issues that surfaced during the history. You want to encourage people to eat fiber, eat fiber, eat fiber, eat fiber. Fiber is the food for the good bacteria that make the neurotransmitters and the acetate that goes to the skin and helps to change the skin microbiome and make it less friendly for acne. The last conversation that I'll talk about, and we'll wrap up, is the hormone balance conversation. You're all familiar with this graph. Testosterone gradually declines, but for women, female reproductive hormones just fall off a cliff. But there is and as that happens, you'll see pH shifts, microbiome shifts, acne, increased susceptibility to injury, flushing, vasomotor symptoms. And we have this period, which always seems a little bit strange to me, of estrogen dominance. Because here's what happens. The estrogen only gets reduced by 35%, but progesterone decreases by 75%. So some of the vasomotor kind of symptoms that women have is actually the result of estrogen dominance. And we can fix that with some of these supplements that deal with cruciferous vegetables. DIM, diindolyl methane, is ground up broccoli. Red clover, black cohosh, maca, milk thistle, rhubarb root. A lot of good nutritional supplements for this to help women in this period of time. Now, what's standing in our way? What are the barriers? The first has to be knowledge. Some of you obviously are very competent in this area, others less so. A process and products. Well, I've talked about a little bit about the process. Process is ask, inquire, have these discussions in the course of things. But the other two pieces, the knowledge and the products, I want to just briefly address. I've created the Inside Skin Beauty training course. It's 10 hours. It's a model that starts off with personalized assessment, diet and lifestyle, focuses on intelligent supplementation, then talks about biostimulation and daily skincare. It's 10-hour training. I'll come back to that. It's got 3 parts. How do you feed your skin from inside out, outside in, and implementing your Beauty from Within program. You will find many of the products from these guys here explained in the training course. So I see Energet as essentially a delivery mechanism to start and jumpstart that regenerative process in the dermis. This is some of our faculty. We've got some of the world's great faculty from the integrative and functional world. This is the QR code for those of you who are interested in it. But in keeping with the way we always do things here at Beauty Boss, there's always a special giveaway. And I will give away one course to the first person who can tell me how many cells are in the human body. No Google, no Google. Get close. Now we're guessing. Get close. How many cells? You're sitting there. You're a bag of pulchritude. I don't know if is that good. Bag of pulchritude. Well, you're a bag of cells. How many cells are in your body? 7. I got 7. 30. I got 30. Huh? There's my man right there. Come see me later. You get a free Inside Skin Beauty course. So I will thank you. The only 2 females in my home who pay me any attention these days. There they are, and that's how to get hold of me. Hit me up on LinkedIn or Instagram. Thank you so much for your participation.